let's do something. Let's get this information out, and let's collaborate. So I have quite a few slides. I'll try not to talk too fast through them. I will be able to share the recording, although when we show the film LUKi and the Lights, we will have to stop recording, so we won't be able
Okay.
to show that recorded. But you can go in and watch it at any time, absolutely. But I just can't share the recording of it.
Okay.
But so I'm just going to dive right in. Please, please, if you have any questions about anything, pop it in the chat box or the Q&A box, and I'll do my best to have some time after for Q&A. So maybe Naomi, if I'm getting close towards the end, just put the like
Yeah,
tell me to stop at some
I
point.
will. I'll keep an eye in the
Because
chat
this
for you too.
this is my topic. I could go on about for hours and hours on this, so I'll try to keep it limited. Um, these are just the things I had in mind, talking about how do we identify children and youth and families, conversations across professions, what are different professionals and different professions across professions, profession saying about how do they talk to their families and how do they help their families and their children understand the disease and process and care, and then being able to integrate those discussions and support using all of the tools and all of the resources that Naomi talked about. Very briefly, Naomi already gave me a really lovely introduction, but one of the things that I love to highlight is that even though now I am a professor of social work and I do a lot of research and a lot of applied research across illness and injuries, I'm primarily in neurological conditions and ALS and Parkinson's and Huntington's and Alzheimer's. I still wear my clinical social work hat. So I was a clinical social worker for many years. And I have to say that something that I really wish I had when I was a medical social worker was someone doing a webinar like this. Like, it's okay to help families talk to their children, and here's some ways to do it. So I think about myself and my history as a social worker whenever I'm doing these talks, and I really think about what I would have appreciated as a professional. Something I think is incredibly important to start with is, as you think about interacting with the families, as you think about the work you do in the home, in the clinic, in the community, taking just a moment and thinking about who you are as a professional and where you stand and how your beliefs and how your not just knowledge about the topic, but particularly your personal experiences and your professional experiences often really affect and color how we do or do not have conversations, particularly around these. And this is a tough one because there are lots of schools of thought around, should children know things? Should they not know things? Are we protecting our children? And then when we get into the topic of children providing care, then that brings in lots of other kind of personal beliefs, cultural, spiritual, whatever it is. So I always highly encourage our professionals to just think about where you are personally, process that, kind of own it, and then put it a little off to the side, because what we know is that children and youth really want to know this information. Families need to have the guidance and the resources. And so we need to kind of see how we feel about it and then put that off to the side so that then we can be as open and supportive as possible. So, what do we know just writ large about families and illness? Um, when children are in families where there is an illness with the parent, with their grandparent, they do experience many of the same things that the parent is feeling as a result of social and peer isolation, mental health impairments, as a result of the lack of information when they're kind of kept in the dark, when they don't really know how the disease will progress, what are some of the outcomes, and they feel anxiety and fear and often guilt. And that's really to do with the fact that our parents, our grandparents are not only struggling with, oh, I have this diagnosis, but I have absolutely no idea how to talk to my child about it. And we want to give them all of the tools possible. We want to give them grace and we want to give them support. And because what we know is over time, children and youth who are living in families with an illness may experience some poorer coping skills, self isolation, and we don't want those things to happen for a long period. We don't want them to become complicated. So, our role as healthcare professionals is to think about who are we talking about and how can we help them. So here's some data on families in ALS and MND. What you'll notice here is we do not have detail as to how many families living with MND, wherever you are around the world, and you have a child or youth in the home. We don't have that national, international data. And that's actually something that I'll talk about a little bit later. But through our foundation, our next steps are to do a global survey to really wrap our hands and our minds around this. But the data that we do have out of the US, out of smaller studies, we really know that we're talking about a large portion of the people living with, and excuse me, I do say ALS because I'm in the US, but I will do my best to say motor neuron disease. I apologize. But the people living with MND, there really are a large portion of them who have a child or youth or grandchild in the family. And the data that I've collected, that some of my colleagues have collected, really reflects the fact that families don't feel supported, they feel isolated, and their children and youth feel very excluded and isolated from the conversation. So, how do we help our families have these conversations as healthcare providers? Well, the first thing we know is that families do and do not talk about the illness. Um, Through a series of studies, we asked families, and they felt a variety of things. One, they felt that they were concerned about crying or being overly emotional. They didn't want to show too much emotion to their child because they were concerned that then that would make their child emotional. They also thought a lot about the fact that they were protecting their child by not telling them. I have another slide about this, but this is something that I get all the time when I'm working with families and professionals. It is often a long-term negative impact to the child by being kept in the dark because the parents truly, and this is genuinely, the parents want to protect and love and shield their child. But we know that long-term, those children become often very isolated and very defensive, and they feel angry towards the parent that they weren't shared with that information. We also need to understand that there are a lot of cultural implications here. There are a lot of cultural expectations, and whatever families you're working with, wherever you are, those conversations have got to be a part of it because it is complex. And we don't want to ignore how culture really does influence a lot of these conversations. A huge one is that families say they don't have enough information themselves about the disease. And this is where you all come in. This is an incredibly important piece, helping the family know as many details as possible about the disease, about progression, so that then they can share it with their child or youth. And in the end, all of these things taken together really highlight the fact that parents are doing a variety of things or not doing a variety of things, but children will respond based on how the parent models. So if the parent is displaying some complicated coping, is not willing to talk about it or unable to talk about it, then we see those things mirrored in their child or youth. So in order to create those open conversations, that's where we're going to walk through some of the questions that parents said about why they aren't perhaps talking to their child. But the first thing I always tell people is tell the families it's okay to have the conversation. Just it's okay, you know. Do it when you're doing something normal, watching TV, going for a walk, eating dinner, whatever it is. It models the normalcy of the conversation and does it make it the talk? Because if you sit down with a child and say, I have something to tell you, then they might blow it up even more in their head, and then that makes it very difficult for them to be able to process it in a more smaller chunked way. So think about being very honest, not using words like kind of euphemisms that don't necessarily make it clear what you're talking about. Begin with basic information. What do you know about ALS? Basically. And please, please encourage all of your families, seek out the experts, seek out the folks here at the Motor Neuron Disease Association. We have loads of materials, which we're sharing everything with you all so that you can have that support in working with the families. And one of the books, we have a family guide, and in the family guide is actually a whole section just on how to talk about ALS or MND by age and developmental stage. So if you think about, I have a 10-year-old, or maybe they have a 14-year-old, are there different ways to talk about it? Yes. And in that guide, we have those resources for you. But the first and most important thing is to help parents realize they can have small conversations, introduce it basically in a very normative environment, because then what you're doing is you're helping them crack that door open. And then that child knows they can ask another question, maybe later, maybe a week later, who knows, when they feel comfortable. And then as they start having those conversations, that door widens. And then it's an open, free flowing conversation. Might be emotional, but it allows that family to do it in small bits, knowing that it's okay to start and have that normative conversation. So this is a question I get a lot. Like, what if they ask something that I'm not prepared to answer? Trying to figure out where to put you guys. Um, Ask the family member, how would you like to talk about it? What would make you comfortable? So if they say, I'm not ready to talk about what's going to happen at the end of life. I'm not ready to talk about how progression is going to happen. Then sit down with the family and ask them, how would you like to talk about it? Do you want to say anything? What does that look like? What makes you comfortable? Then we also help the families say, you know what, it's okay to show that there are difficult things to talk about, and let the children know that sometimes it's hard to talk about these things. And there might be a time where I need to maybe step away and think about the best answer, but I will get back to you. And I always, always encourage families, don't be afraid to say you don't really know the answer, but that we're going to find this out. And that's where they get to engage with the healthcare professionals, with the Motor Neuron Disease Association, helping families be honest, helping them show that it's okay to have these difficult conversations, and that we will find the answers together as a family. Nope. This is the question that I get absolutely the most, and where families really feel strongly. Um, I'm protecting them by not exposing them to all of the details. And yes, you do not have to sit down at one point and go into absolutely all the details. You might not need to go into extreme detail for a while. But if you think about how and why parents are protecting them, it very often comes from they don't know what to say. They just don't know what to say because they themselves have not been able to kind of sit with it and figure out how they feel about it. Um, Also ask them, they might know their child really well and they won't be able to handle that information. So then how can they engage another trusted source, a family member, a friend, a therapist, clergy? Can they be helpful in having these conversations if they know their child might get extremely emotional, say? But if the response from the parent is, I just don't want them to know, this is a huge caution. And I can't say it strongly enough. We know from a variety of studies across illnesses that children can internalize this. And they'll internalize that either A, they've done something wrong and they're undeserving of the information. They'll internalize that they're not to be trusted because remember the internets are there and they can read and find all kinds of things. So they know that something's happening, but the parent just won't tell them. And this can create some very, very complicated family dynamics. And particularly after the person with ALS dies, some very complicated grief because those things were unresolved. So I highly encourage families, if you absolutely feel like you do not want them to know anything, you must dig into why that is and reach out and get support and understand that the children deserve to know something and work to figure out what those details are, how you're comfortable, but start the conversation and even have little bits. Because again, as that door opens, the communication opens as well. And one thing that this was a quote, a 16-year-old who had a dad with ALS. This idea of creating a new normal seems very like kind of psychology speak, right? But it's very, very true. And children are resilient. They are accommodating. They are flexible. And so, if we can help our families look at the illness as a way of adaptation and creating new normals almost every day, as opposed to looking back and saying, we can't do this and nothing's ever going to be the same, then we're negating that child's ability to be adaptive and to be resilient and to integrate changes. It's that you want to encourage your families to live with ALS, MND, and not in spite of it. And this is not easy. This isn't just a snap your fingers and it's fine, but it's a constant conversation with families to help them say, well, okay, this thing has changed. What can you do now to adapt, to accommodate, to do something different? And children are very flexible when it comes to this kind of thing. This talk that I'm giving you all is part of a series of resources that we have at. So I realize the slide is later on, but one of the things that I do is run a global nonprofit called Global Neuro YCare. And the whole goal of Global Neuro YCare is to take resources like this, like the books, like LUKi the Lights, and make it as available as possible to people across language, culture, in a very easily accessible way, because that's a huge barrier right now. We don't have enough resources really across language and culture, and that's the goal. And so this talk I'm giving you is part of something we're building called the ALS Talk, and really helping to support families in these conversations by giving the professionals the tools, giving them the guidance through webinars, in-person workshops, educational materials. So as we continue to build them out, a lot of the materials in this brief PowerPoint are going to be part of the ALS talk. So, what I wanted to do now is break out some conversations around talking to children and families by profession. So I know there's quite a few of you on this call. I don't know what profession you are in, if you're physicians or nurses or social workers or physios or speech therapists, but we have a few um, talking points and a few suggestions by profession that are incredibly helpful when you think about, ugh, maybe I'm going into someone's home and I want to be able to talk to them about their child. And through a whole series of interviews, again, for the ALS Talk series, this is some of the interview data that we came up with. So for our social workers on the call, yes, I started with social work first. I'm a social worker. So for our social workers on the call, when you're in a clinic or in a hospital setting, and you're meeting with patients, just ask if they have a child or a grandchild. We know they're not bringing them to the clinic. So ask them if they do, utilize the tools in the books, have things available to be able to share. um, Making sure that if you're in the home and you meet with that child, ask if you can have a conversation with them that is maybe separate from the family, so that if the child feels like, they want to have a conversation with a healthcare provider, that they have that safety, obviously with permission of the parents. Um, get them to talk about their family, what their typical day looks like, help them to tell their story so that you can figure out where some targeted supports might be helpful. Is it just information about ALS? Is it information about caregiving? Is it school supports? Use these opportunities to engage the child or the youth to help that family have a broader conversation. Um, this is an interview we did with a pediatrician, and they see the children obviously as a pediatrician, but a huge encouragement for all of, if there's any pediatricians on the call, but any other pediatricians, is to ask about, do you have child or young person? Do you have a family member with an illness? Do you have someone living with motor neuron disease? Um, have resources available. One of them is a graphic novel, which I'll show you in a moment, is absolutely available. And we'd love to be able to get that in as many healthcare clinics and sites as possible. But definitely, checking in with the parents. How are things going in school, day-to-day activities? Because when children are internalizing and really struggling with that parental illness, then it's coming out in school. It's coming out in how they interact with their peers. And a pediatrician is a wonderful opportunity to kind of have those conversations because the kid is present. The child is there with that parent. The PTOT perspective. This is where children are deeply involved in care. And this is a great opportunity for our physios and our occupational therapists to really ask the parents about, like, is your child involved in any sort of transferring, using devices, any technology? Children are great at technology, and it's a good opportunity to start engaging that parent around not just how the child is helping with care, but helping them about that conversation as you talk about, putting a ramp up or getting a power chair in the home. Ask if the child can be present so that they can be a part of learning about how the power chair works, and making that child feel engaged and feel involved. From the speech perspective, it's also amazing to get the children involved and to encourage the family to talk early and often, particularly around voice banking, around those types of really important communication. I can't say enough how often children say, I wish I could still hear their voice. And children will be such an advocate to get their family member to record everything possible, every silly saying, every love word. What is it that they want to hear? And it's a wonderful way to get the family having a fun activity not the best context, but the activity itself is fun and engaging, and the children can be a part of that. And it's a great way to help families have conversations around ALS and progression when they're doing, again, things like, what do you want me to record? How do you want it said? How can we put this together? The other thing I want to make sure that we address, and I think I'm doing okay on time, but I'll keep moving fast, is end of life. Oh, we as a society just do a terrible job of talking about death and dying. Like we just don't, as adults, we just run from it. But in all of the research that I've done and my colleagues have done, children want to know. They want to talk about it. They want to understand what's happening. They want to be able to express their feelings. And they're not able to say, like, I want to talk about my grief. They just want to say how they feel. And they benefit if there's, I feel like this is a bit of a broken record, but children absolutely benefit from clear and specific information because they feel more comfortable, they feel able to express their feelings, and they feel like they are heard. And they draw their cues, much like the earlier conversation about family members who just didn't want to talk about ALS. And so they kept it to them. Children do the exact same around death and dying. They draw their cues about talking about it or not talking about it from their parents. And so, as you're working with family members and you're working to help that adult get to the point of how they feel about their own mortality, help them know that their child is having the same questions. They're trying to figure out what's going on and how they feel about it. This is data from a study I did in Huntington's disease. And when I asked children what they know about their parents' end of life wishes, had they ever been talked to about it? And, for those of you who don't know Huntington's, incurable, no treatment, no cure, purely genetic, absolutely to be, less clinical about it, it just decimates families. And the criticality of having conversations around an illness like that cannot be underscored enough. And what we know is that even in a disease like Huntington's, where people have 5, 10, 15, 20 family members, we're seeing more and more genetic markers, genetic variations in MND, that this is becoming just as important. And what these kids said is that they want to talk about it. They are willing to have the conversation. But you'll see that a lot of times they see that their parent isn't ready, their parent is in denial, but they also felt like their opinion just wasn't valued anyway. So why should I even bring it up? Or they felt like their parent didn't want to, so they wanted to respect what their parent wanted. And so you have this group of children and youth who want to talk about it, but they see those barriers that the parent is displaying outwardly, overtly, or not quite so overtly, but they pick up on it. And this is where it's incredibly important for us as professionals to help families process anticipatory grief. So, if we know that families aren't talking about death and dying, but kids want to know, they want to understand more about end of life, what we also know is that as they go through that grieving process, there is anticipatory grief, which is well before the person dies. And in ALS, we see it at a variety of different time points. At diagnosis, there's an immediate, like, they're going to die. This is a huge change. There is grief well before that person dies. But what we also see is that as this disease progresses and things change, and a new symptom leads to a loss of function and the loss of voice and the loss of bear hugs from grandpa, dominoes with grandpa. I remember one youth told me this whole story about now grandpa can't play dominoes because he can't use his hands anymore, and it just broke his heart. And these are children who are grieving in different stages, anticipating that eventual death. So helping families go back to that, what is their new normal? How can they talk about this is what we're doing now? And let's talk about how we feel about this. Okay, things are changing. This is a new symptom, a new loss of function. How are we doing at this point? Because then they can manage those anticipatory stages as they move along. The next section, and I know I don't have much time, so I'm going to go through this quite quickly, is the role that children and youth play as a caregiver. And there is a wonderful organization. If you guys don't already know, you probably do because you're in Ireland and I'm not, but Family Carers Ireland, they're the ones that do a lot of resources and supports for children and youth who are caregivers. And I couldn't find any actual data for children and youth as caregivers in Ireland, but they are definitely there. Um, I will say in this slide, anything that an adult does to provide care, a child is doing somewhere. So there's no barrier between that. This is data that was done out of the Carers Trust in the UK. And we see that being a child or a youth as a caregiver can have absolutely an impact on everything that they do, their leisure activities, their career, family, physical health, mental health. So providing care is critical, but it's also very positive. Children and youth are not hating the opportunity for care. What they're saying is that they love doing it, but they need support. And this is where you can have conversations with families about the role that they play as a caregiver, helping them in the same way that you would with the overall conversation about MND. This is where they can model the conversation and help identify their feelings. How do they feel about a child helping them with care? Help them use I feel statements. Help their child know that they can talk about it, and that help their child know that if they feel like there's a care task that they're doing that they're not comfortable with, that they can go and say, this makes me uncomfortable and I want to know more, or I need more help. And one of the things that we do at Global Neuro YCare, so we've got three kind of primary pillars. And the first one is that YCare program. And I will be in Ireland in October for the national meeting. And I will spend a lot more time talking about the YCare program there. But suffice it to say, it's a day-long program where we partner with healthcare professionals to deliver hands-on guidance and training and care tasks to children, youth, and young adults in small groups. The children have so much fun. There's all kinds of fun of activities, and they leave with connections to healthcare providers and friends. The other one is LUKi the Lights, which I'll get to in 2 seconds, but then I wanted to skip to the materials. So we have lots of resources for children and youth, and you'll see that they are in, so far we have them in 13 languages, and that's the isiZulu for our South African colleagues. But we have resources for LUKi the Lights. We have a coloring and activity book. We also have a whole guide for professionals to help you all walk through the film, answer questions. There's a Q&A just for children, little children, that's coming from LUKi, helping kids understand ALS. There's a Q&A for older teenagers, helping them understand ALS. And then also, I just finished a book with ALS Canada on genetics. And this is a really deeply developed book with genetic counselors, with families, to help you all help families understand how to talk about genetics with children, which is huge. So there's that. Okay, LUKi the Lights. Do I have time or are we out of time, Naomi? Oh, you're muted. Oh,
I think we have time, Melinda. And then what I'll do is, once we go into the movie, I'll stop the recording.
yeah.
And then we can share the link to everything anyway on the way. So fire ahead. You want to
All
talk?
right. Okay.
Yeah.
So LUKi the Lights was created by this amazing family here in the Netherlands, Sasha and Anjo. Anjo was diagnosed with ALS at the age of 35. They reached out to me because the graphic novel I wrote had just been translated to Dutch. And they had this amazing story of a robot, LUKi, full of light bulbs. And he gets ALS and the light bulbs go out. And we use no words. It was absolutely brilliantly animated by Big Rin Productions in Los Angeles. And it shows progression, caregiving, and death. So I'm going to move quickly into the